very fortunate to have Radha Saini. She has recently joined as the WHO consultant for Philippines. Before her MPH, she was serving as the senior consultant in WHO in Sierra Leone, that is West Africa. So after that, then she joined the MPH program in Bragg University. So last year, if I am not wrong, please do correct me. Last year, she has graduated from Bragg University, and now very recently today, I was I was able to know that Radha has joined as the consultant for Manilla in Philippines. So let us congratulate Radha for such a big career that you are uptaking from here onwards. And today we will be discussing about the bioethics, as most of the esteemed participants are well aware of what the bioethics is. So Radha will talk on the history, then the current scenario, as well as challenges that is faced with the medical professionals while maintaining the bioethics. Uh, I have nothing much to talk as Radha is one of the experienced medical fellow. She has 20 years of experience in the field of nursing, and she has around 64 publications so far in national and international journals. So this is what Radha is all about. So the floor is yours, Radha. Please go ahead.
Thank you, Dr. Panjur. First of all, a very big namaste to all the participants who have joined all the way from Africa, Sierra Leone, Bhutan, Bangladesh, India, and even one of my students from Ireland, Madam Amrita. Thank you so much for joining us. Well, as we begin with the blessings of Shri Vaheguruji and my teacher, Ma'am Thankam Gomes, who has been my mentor and a nurse with a difference, I hereby begin my presentation. So as I begin my presentation, I joined very recently in WHO Manilla as a Philippines as a WHO consultant. So what is basically bioethics? What we are dealing is right now, what we are dealing is with the bioethics history, current scenario, and the challenges. Basically, bioethics is the application of ethics to the field of medicine and healthcare. All the controversial ethical issues which are emerging from the new situations as a result of advancing technology, scientific innovations, as a result of medical innovations coming every day. We have newer discoveries coming every day. We have new invent of medicines, pharmaceuticals, right? We have new technologies coming up. So the same are the pros and cons of every technology. Pros and cons of each and every healthcare scenario, and how the healthcare professionals have to deal with the challenges, the issues, and the dilemmas coming in this. So bioethics is a study of typically controversial ethical issues which are emerging out of the new situations and possibilities brought out by the advances in biology and medicine. So if we see the history, the Second World War was between 1939 to August 1945, in which Adolf Hitler was the person who was the leader of that Second World War. So in this World War, the Jewish people were the one who actually underwent all kind of cruelties, exploitations. They were tormented, and this was the biggest genocide of the world, in which you can say the medical experimentation actually began in this phase. So Jewish people were the one in this Nazi concentration camps, in those Nazi regime, they were the one who have actually underwent this kind of torture. So this is, you can see a patient of Nazi medical experiment, how he's immersed in the cold, icy waters, while one of the doctors, Sigmund Restor, in those areas in Germany, in those times in Germany in 1942, to see that how the body cells and how the tissues in the body are reacting to that much by submerging that body in those temperatures, in those freezing temperatures, how the body will be reacting. So this, and no ethical principles were at those times, no bioethics was conceptualized at that time. So this is the way they were tormented to their death. Here you can see a disfigured leg of a survivor from a Ravensburg's Polish political prisoner, Helena. Her name was Rafalska, if you can see a nickname, and she was given without anesthesia. Her legs, their legs were sutured without anesthesia, and pieces of glass were inserted inside. And this is the way she was brutally tortured in those Nazi concentration camps. If we see even some of the more pictures, in those days, they were black and white camera. And we can see a prisoner, how he loses the consciousness and later he dies when he is tied on the aircraft, to see how he is surviving without oxygen in those layers of the atmosphere. As you all know, stratosphere, lithosphere, troposphere are different layers of the atmosphere. This is the way how he loses his consciousness and later he dies during an experiment to determine the altitudes at which the aircraft crews could survive without oxygen. So actual medical experimentation began in those times. The Holocaust was a genocide in which Adolf Hitler of the in Adolf Hitler's Nazi Germany and its collaborators, they killed 6 million Jews. In 1 million, we have 10 lakhs. So here we have 6 million Jews who were actually sacrificed so much brutally. They were killed. So this was a massive genocide or the massive catastrophe which took place. And he didn't even spare any children. 1 million children were there who were subjected to that kind of brutalities. They were tormented, they were exploited, they were left to feed for themselves. And this experimentation, it included putting them in pressure chambers, gas chambers to see their suffocation levels, to see their depleting oxygen levels, testing of the drugs on them, different chemicals on them, freezing them in the ice chambers, attempting to change their eye color by injecting chemicals and dyes, different chemicals into their eyes, and even amputations which were done without giving them any anesthesia, and even plethora of other surgeries, and which were done in completely immoral, unethical, and unacceptable ways. That was the kind of torture which these people have actually undergone, and they were the Nazis in those Nazi concentration camps during the Second World War, which was between 1939 to 45. And this was the time when the medical experimentation began. So this all is regarding the history. This is the plight of the children. As you can say, they are starved with kwashiorkor and marasmus, which we call as the protein energy malnutrition diseases. This is the way herds and herds of people were brought. So these people were brought to be put up in the chambers, or you can say boilers, the boilers where your body is going to completely burn. And that, as you know, the boiling point of water is 100 degrees centigrade. In these boilers, they were put it up, and mercilessly they were killed inside those big gas chambers and the big oxygen-less chambers. This is an infamous Tuskegee syphilis study in the USA. Tuskegee syphilis study. Tuskegee is a place in USA, Alabama. Here, what actually happened, it was conducted by the NIH along with the US investigators. So what they did is, past 40 years, they went on cheating. They took these Africans for a ride, what we call them. They cheated them, saying that you will be treated for syphilis, every kind of psychosocial support and monetary compensation will be given to you. But in actual, nothing was given to them. So they kept on taking their cerebrospinal fluid from the brain. And on that cerebrospinal fluid, a lot of experimentation was done, and they left their syphilis untreated. But they took the promise that they are going to treat the syphilis. As we all know, syphilis, gonorrhea are the sexually transmitted diseases. So these poor people, they were exploited to their maximum by these American people for the last 40 years in collaboration with the NIH. And this Tuskegee syphilis study was an infamous clinical study which was carried out to see the natural progression of untreated syphilis. But this was not told to the people. They were told that they will be treated for syphilis and they will be given good compensation. So now, can you believe the Obama government, after in this just a few years back, in the, I think the year 2010, now they have sent their unconditional apology, and a very big university is now being set up there, and very big memorials are being set up there for those people who actually lost their lives. So can you believe that the Americans went on experimenting on these poor people? They just experimented on them, and the Tuskegee and this syphilis was left untreated. So this was a study which was done by the Americans on the Black people who were living in Alabama. So now, if we see now after this, in the year 1947, the Nuremberg Code came up. The Nuremberg Code was again a set of, they were a set of research ethics principles for human experimentation, which were set as a result of the subsequent Nuremberg trials at the end of Second World War. So they were made in 1947 by the US, by the part of the Europe also, and they are a set of 12 principles which are actually for safeguarding the human life, safeguarding the human rights, safeguarding the dignity of the human life, or saving the prestige of the human life, for basically nurturing the human life. So what all things are required to be done when any human experimentation has to be done on the human participants. So this is HeLa cell line. This is a very painful story of a lady called as Henrietta Lacks. In the year 1951, she went to Johns Hopkins Hospital for getting treated for cervical cancer. There, one of the doctors noticed that her cells were multiplying at a much faster pace as compared to other people who had cervical cancer. Can you believe she underwent that clinical phase of those trials? She underwent the complete painful ordeal of a clinical trial without any bioethical guidelines, and her cells are still kept frozen, and a lot of medical experimentation has taken place on those cells. Even now, medical experimentation has taken. So her cells were taken for the further, you can say, as for the cancer treatment, for the cancer regenerative therapies, for even the for the further, and a cell line was made up of that, called as HeLa, HeLa cell line. He comes from Henrietta, La comes from Lacks. So there was an author known as Rebecca Seclude who has written a book on her life called as The Immortal Life of Henrietta Lacks. And even now her cells are given for the cancer regenerative therapy, and even for the cell therapy, stem cell therapy, which is taking place for all these myelomas and lymphomas, or even this bone marrow transplants, where these cells are given free of cost to all the patients who are now being coming to the Johns Hopkins Hospital, and to give a dedication or to give a salute to that life. She has written a book called as Immortal Life of Henrietta Lacks, and she has primarily discussed how unethically she was treated. So she has actually undertaken a complete study of her autobiography, how she was brought there, and she died at a very young age of 31 years. So her name was Henrietta Lacks, and she was a patient of cervical cancer whose cells have now become history, and now they are the found head of medical research in cancer all over the world. So this is the clinical trial.
Excuse
Yes,
me, Radha.
yes, sir.
Could you speak a little bit closer to the mic because we cannot hear that much clear. Your volume sounds quite low.
Okay.
Thank you.
So
You have
now,
17 minutes left. You have 17 minutes left to end your presentation, then followed by then we'll have a discussion part.
okay, so now the clinical trials and the bioethics current scenario, we have 1.4% of clinical trials going on in the pharmaceutical company trials, and this turnover is going to increase by the year 2080. So now we have the first issue as the euthanasia. Euthanasia, as you know, is the mercy killing. So they are the rights which emphasize alleviating the suffering, bodily integrity, self-determination, and personal autonomy. So this is voluntary euthanasia, which is carried by the consent of patient, non-voluntary euthanasia, who are not in a condition to get killed. And then we have is assisted suicide, where the patient brings his or her own death. So if we see, who is she? Her name is Aruna Shanbag. She paid the price of being truthful. She was a nurse who worked in King Edward Medical College in Mumbai. She was a very truthful nurse for her duty. She stopped a ward attendant for stealing the biscuits. He was stealing the patient's biscuits and milk for his dog. He used to feed his dogs with those biscuits and that milk which he used to steal from the ward. She was the one who complained for that ward attendant. And what he did sodomy, or he did rape that nurse, and he used the same iron chain for strangulating her neck. She went in cerebral hypoxia, in a permanent vegetative state, and her with a cortical stem injury, complete stem cell, cervical injury. And she was, for 44 years, she was lying on the bed of King Edward Medical College in a semi-conscious state. This is the present Aruna, if you can see here, and this was that Aruna at those times. She had to pay the price for being honest. And this was actually 44 years when she was on the bed, she was given so much meticulous care, and she didn't even get one bed sore, not even bed sore, one bed sore. And this shows the quality and the volumes of medical care being given to her, to Aruna, by her fellow nurses, by the fellow doctors. Everyone used to take the nursing pledge and the medical pledge inside her patient's room. And this man is now out on bail, but this lady, by this incident, the government of India was really jolted. For 10 years a public interest litigation was put it up in the Supreme Court of India to give her euthanasia. But passive euthanasia is allowed in India, but not the active euthanasia, because uh, if they give passive active euthanasia, tomorrow maybe there is a medical treatment which says that yes, now there is a treatment for permanent vegetative state. Maybe tomorrow there are unscrupulous these children who will connive with those unethical doctors and get their parents killed by virtue of the verdict of this court. Thirdly, maybe tomorrow the technology is advancing very high, so tomorrow we have a treatment for this disease, so where will you justify the ethics? So these 2 points were the main points by virtue of which this is Mr. Justice Markandeshwar Katju, who and Gyan Sudha Mishra of the Supreme Court of India, who laid the new guidelines of euthanasia, that active euthanasia will not be given because of these 3 reasons. One is that tomorrow doctors will be conniving, the unethical doctors will be conniving with the patients, with the unscrupulous, you can say, children who will get their parents killed. Secondly, maybe tomorrow there is a treatment for permanent vegetative state and cortical stem cell injury also. And thirdly, it will, one point I missed, thirdly, the thousands and thousands of nurses who cared for Aruna past 44 years, they will go in a state of disappointment. So to, you can say, because no nurse and doctor can see a patient dying when we have given so much meticulous care to a patient past 44 years. So not to make those nurses and healthcare professionals go in any kind of agony or mental trauma or any kind of disappointment. So this, our Supreme Court of India said that they will not be given, she will not be given the euthanasia, and she died a natural death. But the second issue is of this surrogacy. Now, this is a very big issue in India. Earlier, India, even now, India is a hub of medical tourism and surrogacy. We all know what is surrogacy. We all know what is surrogacy. This is the biggest issue. In the year 2019, the Indian Council of Medical Research, along with Ministry of Health and Family Welfare, they promulgated the ethics for surrogacy, in which a certificate of essentiality, infertility, whatever issues the couple has, it has to be brought, and only altruistic surrogacy is permitted, only when, and not commercial surrogacy. You cannot make you can say, designer babies and then sell them for prostitution, of a child abuse, of a child labor. No way. If now we have the surrogacy bill of 2019, in which altruistic surrogacy is permitted, only women of till 35 years of age are permitted to be surrogate mothers, and plus they need to be in a close relation of the patient who actually requires a baby. But there are issues. What about the gays and the lesbians? How about they are not allowed to adopt a child either, or they cannot even make a baby or request a surrogate mother for a child? What about the transgenders or the Hijra community in India, or these people? How about these people? This is a big issue, and right now there is another court verdict coming up on these people, because. And how about the people who are living in live-in relationships? Nowadays, the concept of live-in relationship is also coming up very high in the metropolitan cities in India. In Europe and US, it's already it's in complete, you can say, blossom. But in India, it's just on the it's starting point, you can say. And as per the CARA is concerned, CARA is Central Adoption Research Authority. This says the couples who have been married for at least 2 years, as well as single women, or who can adopt a child. A single woman can adopt a child of any gender, but a single man can only adopt a male child. Why a single man cannot adopt a baby girl? And similarly, couples who have been married past 2 years, only they can adopt. So there are a lot of ethical issues coming up out of the CARA also. These are the ethical challenges in the healthcare system. Healthcare delivery system in India. In Sierra Leone, it's so truly crippling healthcare delivery system. In India, if we see the healthcare delivery system, starting from the Director General Health Services at the central level, till the state institutes of health and family welfare in every state of India. We have 30 states in India, and we have about 8 union territories in India. So now What are the ethical issues? First is the inequality in the access to the healthcare. Secondly is the unequal distribution of healthcare facilities. You go to Lahore Spiti in Himachal Pradesh, you go to the Leh and Ladakh in India, you go to Andaman Nicobar, those tribes, the tribal areas of India, Andaman Nicobar, full of water. There are 35 aboriginal tribes over there who are on the trees, who are away from the mainland. There is unequal distribution of healthcare facilities. We cannot expect a tertiary care hospital like a medical college to be over there. Thirdly, privatization and corporatization of the healthcare. Big hospitals are coming up, and we have the complete corporate health sector, like we have Fortis Healthcare, we have the Columbia Asia, we have the Apollo Group. Then we have overpricing of the medical interventions and unnecessary prescriptions of the doctors to get the medical commission. That's another issue. Then we have is a lack of quality of healthcare professionals in rural and backward areas. All doctors want to work in the cities, in the metropolitans. Whereas 70% population of India, it stays in the villages as per the census. 70% population, it stays in the villages, only 30% are in the urban area. How about the quality of healthcare professionals? All MD doctors, even DM doctors or even MCF doctors are moving towards the cities or towards the metropolitans. Then we have is the issue of granting or extending patents when we make of a scientific technology. Then we have is the issues related to the disclosure of information to the patient and the caretaker. This is what we call as invasion of privacy, especially in case of HIV patients, in case of transgenders, LGBTs, lesbian, gays, bisexuals, and transgenders. In case you are disclosing the sexual health status to another person who is healthy, like you have people who have sexually transmitted disease, any person even having HIV, any other communicable disease, and you are purposely disclosing their information to other healthier people or their people who are nearby them. So this is a very big ethical issue in cancer patients or in the oncology patients. A recent study published by American Journal of Obstetrics and Gynecology. My every slide will be accompanied by, you can say it will be accompanied by a reference and a research study. It has shown that there is no policy for any kind of compensation or any kind of, you can say, insurance, any financial compensation in India, even in the entire Southeast Asia or even in the Africa, there is no policy. 7,500 pregnant nurses who handled even using the personal protective equipment, who handled the chemotherapy drugs or the anti-neoplastic drug, they had spontaneous abortions. So much so, this means they were unknowingly exposed to the constant low levels of exposure. They are the nanoparticles coming up from those chemotherapy drugs. So those nanoparticles, even if you are wearing a personal protective equipment like gloving, gowning, masking, still they will be affecting you, and they've got spontaneous abortions. So this study has brought into the limelight the workplace issues, you can say, or you can say the occupational hazards, which is again a very big issue, or the bioethical dilemma for the healthcare providers in India, or the chairmen or the government of India, or even in the entire, you can say, Southeast Asia or even the Africa. So here comes this issue of the sleep deprivation. Can you believe melatonin is a hormone which is linked to the circadian rhythm? And this is actually, it has got anti-mutagenic and oncostatic properties. Now, this is responsible for inducing cancers in a human body. If you are working late in the night, you keep your head high, you are rising. I mean, you are not sleeping in the whole night. The light exposure during the night shift work affects the circadian system of the shift workers, and this will be desynchronizing the 24-hour bodily rhythm and be suppressing the nocturnal melatonin secretion. And again, as you know, melatonin is a hormone which is linked, which has got anti-mutagenic and oncostatic properties. It will cause you cancers. Now, there is a very big ethical issue relating to what? To the doctors and nurses who work in the night, to the traffic police people who are working in the night, to the pilots in the Air Force who are working in the night, border security forces, Indo-Tibetan Border Police, Indian Army, Indian Coast Guards, Indian Navy. Not only Indians, this is a very big issue for the entire world, but nothing is being given to them. So both lower melatonin levels and sleep deprivation have been linked to increased cancer risk. So that is the biggest thing. So now they get what we call as breast cancers, endometrial cancers, prostate cancers, colorectal cancers, and even non-Hodgkin lymphoma. This is again a groundbreaking research which got published in American Journal of Epidemiology in the year 2013. So now, these are some of the societal ethics. Kindly clear your concept. Never say any HIV positive patient to be AIDS patient, because AIDS is the last stage of the HIV disease. Being HIV positive does not mean that you have AIDS, for sure. Next, this is a Bollywood movie directed by a South Indian director, Revati, Fir Milenge, where Salman Khan and Shilpa Shetty and Abhishek Bachchan are the protagonists. In this, they have clearly shown the line of demarcation is very clear here between a HIV positive patient and an AIDS patient. So you are actually socially ostracizing any person if you call any person AIDS patient, because AIDS is the full-blown case of HIV after 7 to 9 years of incubation. So you are actually belittling someone by doing so. This is a big abuse. Rather, you are even invading the privacy of the person. This is a movie made by in Saranj. This is a movie in which Anupam Kher is portraying the main character. And here you can see Bhagwan, the plight of geriatric people or the old age people. What about the old age people's ethics and morals? Are we actually protecting our old age people's morals? So this is another movie called as Bhagwan. So this movie has clearly shown that what people, these old people like geriatric abuse, geriatric violence, what they are undergoing by the generation of today's time. And it also includes emotional neglect, what the elderly are facing now in the 21st century. Saranj, they have shown the plight of a father, ordeal of a father to collect his ashes. The son is killed in USA, and the father's plight in taking his ashes from the airport, and what he has to actually undergo, his emotion, how he was able to convince and tell his wife that the son has died, and these are the ashes which are now sent by the American government to the India. Saranj is the very painful movie of a man and his plight. Are we actually giving this life to our patients? We ought to give this kind of life to our patients. Let us not snatch this smile. Let us protect this life, a very tender life. We need to protect it by all means. To err is human. To admit is superhuman. My teacher, Ma'am Thankam Gomes, told me that Radha, never repeat your mistakes. And that is the principle of my life. If I commit mistake once, I try that I never ever repeat my mistake, and I never give a chance to another person to scold me, to snub me, or to reprimand me on another basis, on any other chance. So helping hands are more holier than praying lips. I say my mom, I am staying, for example, in Manilla, and I say to my dad, my dad is sick. I say, Dad, I'm sending you money. Servants will take care of you. Attendants will take care of you. No, what my hands can care for my father, a servant cannot do that. What we can, our hands can give care to a person. Praying lips cannot. So helping hands are more holier than praying lips. What we can give hands with the care with our hand, the therapeutic touch, therapeutic communication, holistic nursing care, mixing all the components of Ayurveda, Yoga, Unani. So if we are giving care in a very therapeutic manner, the results will be very best. Results will be what we call as, here also comes the concept of evidence-based nursing, or what we call as the holistic healthcare system. So helping hands are always more holier than the praying lips. I respect my Deputy Director, WHO Vice Chancellor of Sierra Leone, Dr. Onike Rodriguez, to my right side, wearing gray and red frock, for giving me endless love, for giving me so much love and affection, and being empathetic with me. Main is empathy, how much empathetic you are towards your employees. At my back in blue shirt is her sister, who was the, right now not, in the previous government, she was the health minister of Sierra Leone. At the back is their brother. The entire family loves me a lot, and they give me a lot of empathy, empathetic and motherly love and affection while I was in Sierra Leone. Only because of them, I was able to adjust in this war-ravaged, resource-constrained, vulnerable, and poverty-stricken country. Fine. So thank you to all the beautiful girls and the handsome guys for being patient. Thank you, Benjo.
Very much. We really appreciate the way you presented very important topic. Uh, I believe that most of the participants are holding the medical background. Uh, Without ethics to deliver the service to the needy patients, I think no matter how expert you are, the service may not be easily accepted by the law. As well as your patients will be the victim of the medical professionals without proper medical ethics. So by ethics, in the principle, it is very core at the medical profession. So where we cannot have the practice of any healthcare services without without bioethics, be it research, be it services.
Question number
So bioethics.
Question number
So from the presentation made by Radha, so I came to
I would like to
understand
have
that.
some question hours session.
Yes. Yeah. Yes, Radha. We will give to the participants for questions. So before we break for the question and answer, may I request you to give a brief glimpse, comparative kind of a glimpse between the medical practice in India and the medical practice that is prevalent in Sierra Leone. Since you served as the senior consultant over there in Sierra Leone, no, I'm really curious of African culture, where how the medical practices are going, and is there any medical or ethical issues?
The biggest bioethical issue I saw in the country Sierra Leone was that there is no treatment for cancer. The rich people, they go to the countries like India, China, Pakistan, or even USA. And the poor people, they only ask for death because they don't have the money. There is no nurses even know how to make chemotherapy. The healthcare practices are very deficient there. I could see that nurses are not actually, forget about evidence-based nursing. Or what is evidence-based nursing?
Comparing to the practice, so what is the beauty, good part of the Indian practice, especially in the
so nurses, they are
sector?
using all the primitive techniques over there in giving the nursing care. They are using all the older techniques in giving the nursing care. Nothing new or innovative, first of all. Secondly, they are not upgrading their education with the latest scientific technologies. This is a second issue over there. Thirdly, what I feel is that, I mean, more and more you are near to technology. More and more you study the latest researches from the journals, in international PubMed index journals. For example, in the bronchial asthma care, now a different technique of pursed lip breathing, we all know we have to do. But I haven't seen any nurse, I have not seen any nurse who actually goes to the bedside and says that please do pursed lip breathing, sit in a Fowler's position, like which I have seen in the nursing between the India and the Sierra Leone. There is no evidence or no sign of evidence-based nursing. Param Mishra, I welcome you, Director Sir from IQ City Medical College.
I had joined as CEO Maharashtra Institute of Medical Sciences and Research, Latur.
Oh, you are not in IQ City, sir?
No, I left.
Oh, okay. Thanks for joining me, sir.
Thank you. Thanks for invitation.
So you are right now in Maharashtra, which place, sir?
Latur.
Oh, Latur. Okay. Where very big earthquake came long back, Latur, right?
Yeah.
Okay.
Long time.
I'm waiting for the questions, please.
Good.
Is there any questions from the participants?
Jerunusha Khatun from this place, Kolkata. Jerunusha, you want to ask something? You want to ask something? Can we see you?
Am I audible? Yes,
can I see you, beta? Can I see you?
My video is off.
Beta, can I see you?
Ma'am, sure.
You want to ask something? You can ask.
Yes, ma'am. Good afternoon, ma'am. Very good afternoon. Thank you for your awesome presentation. Ma'am, I want to ask you something regarding the issue of surrogacy. Surrogacy is the really biggest issue and very much practices. Nowadays, everybody among our celebrity, among our old population, those are having not kids. If I want to, and related to adoption also I'm having on query, if somebody are not getting married also, and they are married, but they are not completed 2 years, then they are not able to adopt children.
No, they have to go to, first of all, a healthcare practitioner to see that whether the infertility is permanent or temporary. And looking at all those conditions, all the medical, the problems what the lady has relating to her reproductive tract, in the man also and the female, they will be issued a healthcare certificate by the doctor. After that, they have to see whether they have to find a surrogate mother who is in close relation to the couple, either maternal or paternal. Are you getting me, Yarunusha? Okay.
Yes, madam.
After
Yes,
that,
madam,
a lot of ethical consents and informed consents they have to take. They have to inform the local police station. They have to inform the healthcare authority from where they are taking the treatment. And after that, only the altruistic surrogacy will be permitted after looking into all those things. Because what happened, long back, a lot of foreign couples used to come to India for surrogacy. And there are a lot of agents in Chennai, in Bangalore, who used to take 20 lakh from the surrogate mothers. And out of which only 1 lakh they used to pay to the actual surrogate mother. Rest of the 19 lakh used to be in their pocket. So a lot of exploitation was actually under these surrogates were actually undergoing a lot of exploitation, by virtue of which the government of India now framed the Surrogacy Act and the surrogacy laws in 2015 under the ICMR, Indian Council of Medical Research has made those laws. And then the bill came up and then it was sent to the this Ministry of Health and Family Welfare. Afterward, it was passed in the Rajya Sabha and the Lok Sabha, whatever things we have. And then it was made, because this was to prevent the, with impunity, prevent the practice of this commercial surrogacy with impunity, what was going on in India. In one case, so there was a twin children, they were born to India. So one child was taken away by the foreign couple, the second was left here only. So who will take the responsibility? The government or the surrogate? In many cases, there was so much of cruelty inflicted upon the surrogate mothers. They were not fed properly. They were not reimbursed properly. They were not given nutrition. They were not given any post-trial access care. So this laws came to prevent any untoward incident and to promote the human life and to preserve the dignity of the surrogate mothers, to avoid their exploitation, prevent the exploitation.
Yes, ma'am. Thank you, madam.
And the age also has to be till 35 years.
Okay. But that means if anyone doesn't have any health problems like infertility or any eligibility criteria, if anyone is completely healthy, thus he wants to adopt his child, then through the process only he can adopt.
Adoption is different issue. Surrogacy is different issue. For adoption, you have to undergo CARA, Center Adoption Research Agency, the Modi government. But that is different. Surrogacy is different. Don't confuse both the things. Okay. But again, the issue of lesbians, gays, bisexual, and transgenders is there. Even a single man who doesn't want to get married, okay, he's not a gay. If a man doesn't want to get married, doesn't mean that he's a gay man. Okay. There are many men who don't want to get married, but they can only adopt a baby boy, not a baby girl. Okay. Then even these hijras or these transgenders, they cannot adopt a child as per the CARA guidelines. A female who is unmarried, she can adopt either both male or female. So right now, a lot of petitions are pending in the Supreme Court and the High Courts relating to these issues of adoption. So don't confuse with the surrogacy.
Okay. Yeah. Thank you so much, ma'am.
Amrita Pandey, where are you? You had a question. Can you please speak your question? Can we see you all?
Good afternoon, sir. Good afternoon, ma'am. Very well presented as always. I am student of Madam Radha Saini during my graduation, and she is the one who has created a keen interest of mine and I think our other classmates in community health nursing. I graduated from College of Nursing, Mulana, and first that I was working under Army Medical College, Army Medical Institute, and the different services as military nursing services. And I have worked for almost 11 years. And now I am settled in Dublin, Ireland. And it's a great pleasure for ma'am for inviting me for this beautiful presentation and upgrading my knowledge regarding bioethics. My question is, as an Indian nurse, do we have the authority to practice bioethics? For instances, there are various instances where we are, our authorities will give us instructions. For example, there's a patient who has been holding a bed for long, for which the authorities think the patient will not be able to get well, or if we have a gut feeling the patient is improving. So how are we supposed to follow this partial euthanasia as told by our seniors, or do we have the authority to hold this instruction for few more days?
Well, Amrita, it's a very critical and a very important question. This our nurses are facing on daily basis.
Yes,
Here
ma'am.
comes the ethical issue. You have to take, if a doctor says you that this drug has to be tested on the patient, the first question you need to ask is whether you have taken ethics committee permission or not in India, in the medical college or in the hospital. Number second, is this trial registered with the CTRI, Clinical Trial Registry of India by ICMR, Indian Council of Medical Research. No human experimentation can take place on patient. Experimentation of any drug or any machine or any even a catheter or even no technology can be tested on any patient without the ethical permission of ICMR, Indian Council of Medical Research. There is a complete CTRI or the registry program that is called as Clinical Trial Registry of India. You have to get your trial registered. Then your ethics committee has to give the permission. Thirdly, you have to take the informed consent or the ethical consent from the patient. Okay, and then you have to give the post-trial access. Even after the experiment has finished, you have to give to the patient. So you have to ask all these questions to the doctor concerned. Now nurses will not just apply their hands. They are not blind. You have to apply your brain also. Nowadays, nurse is not just the brain, handmade tool of the physician. We are not the handmade tool of physician. Now you have to apply your brain also. So after all these ethical consents and permissions, then only you will allow your patient to get experimented. Now, your question was regarding euthanasia. Yes, it has to be given. If active is not permitted in India, if passive is there, or if it is an assisted suicide, then to prevent yourself from legal problems, even the legal problems, you have to take the consent of the guardian if the patient is unconscious. Number first, then signatures of the doctor concerned, physician concerned, consultant concerned, and the signatures of the patient's relatives. If it is a child who is below the age of 18 years, then sub-divisional magistrate of the area has to be contacted along with the child welfare officer of that area. Like I'm from Patiala, Punjab. I have to talk to the child welfare officer if child is below 18. And if the child is orphan. If child is not orphan, then parents can give the consent. Then parents can give. But if child is orphan, then child welfare committee and lot of legal issues are concerned in this, and you have to sign a lot of papers. You have to inform all the authorities well in time. And as far as euthanasia is concerned, you can give, but again with the consent of patient and relatives. And I've told you regarding orphan and regarding children.
And there is one more question, ma'am. There are, I don't know whether it's off the track question. There are many drug trials going on where people from a lower social background are taken as the subjects. The authority says that they have taken the consent of the subjects, but at the same time, they do pay them money. So these subjects from the lower social background or social economic status, they get lured by this monetary importance that they have been given through. So my question is, and most of the trials, if they go wrong, then who should be held responsible? How should be how can that be compensated with life?
Can you believe India, one point some percentage, percentage of clinical trials are in India. They target pharma company sponsor clinical trials, make patients guinea pigs. They make the patients guinea pigs, okay, in these pharma company sponsored trials. All these doctors get benefits like tax, they get cars, they get holiday homes, they get big amount of money, they get a lot of gifts, they get diamonds, okay. And they target the mission hospitals, which are fund staff. Okay, they target those places which are charitable hospitals where people are coming from poverty. Now you are the managing director of a mission hospital. So I am from a company who wants to test my cancer drugs. I made a new drug. I want to test the patients. I say that if you test my drug on your 100 poor patients, I'm going to give you one CT scan machine or one MRI machine for your hospital. One MRI machine costs minimum 10 to 20 crore rupees. Okay, why will you not come to me? Why will you not take my offer in a very positive sense? Why will you not give me? And then both the doctor as well as the hospital as well as the managing director will be under law. They are completely liable to get prosecuted by the law. I have seen doctors going to jails who have given. Long time back, there was a kidney scam in PGI Chandigarh in our place. So now a lot of organ transplantation act came out of that. So now kidneys cannot be sold off by taking from poor rickshaw pullers or from slum dwellers or from roadside beggars or from people who are from the slum areas. Now a lot of laws are there. So if you see anybody undergoing such kind of brutality, where some drugs are being tested, and being a nurse, you come to know that no ethical consent has been taken, you are in full authority to not only argue, but also give a written complaint to the police station, to the ICMR, and even to the local authorities, so that the people get arrested.
But ma'am, like most of the people of our country, they are illiterate and they will not be able to read the consent form, be it in any language. And still they do sign just for the sake of money. And then in return, they do.
It has to be in the patient's language. It has to be in the patient's language. And there has to be a translator while you are telling the consent form, the components of you're telling the components of the ethics form, informed consent, it has to be in the patient's language. Lot of mission hospitals are under scrutiny in Kerala and places like Tamil Nadu, which are fund staffed, and they are actually using the poor patients as guinea pigs in those trials. That is a fact. So I have seen a few cases came in front of me long back where doctors were even imprisoned also, who were trying to test the cancer drugs which were banned in USA in one of the regional cancer centers of Kerala. And even now the petition is going on in the Supreme Court for that. That is why ICMR set it up, Clinical Trial Registry of India, CTRI. So you have to take the permission from CTRI and abide to all the ethical principles which the ICMR has laid down and even now revised also.
Thank you very much, ma'am. Thank you, ma'am.
Radha, we have a question from Meenakshi Vyas. Will you please explain positive and negative of euthanasia? That's a question. Can you please answer?
This is not positive. Euthanasia is passive or active euthanasia. There is no word called as positive or negative. So we have the euthanasia, which is called as the mercy killing, where the patient is conscious and he's asking for that you kill me. I am not able to, get treated. I am having cancer, or I am at the end stage renal disease, or I am into any other kind of disease. Then you can say debilitating condition I am into. My whole house has been sold off. I do not have the money to pay for my treatment. Okay. So in those cases, the doctors can give passive euthanasia. Like it is like, oxygen supply is disrupted. Okay, in the ICU. I mean, no medicines will be given, no procedures, you can say infiltrating procedures will be done, or no blood samples will be taken out, no further investigation will be required, because he says that my body is just a flesh of bones, or a flesh is just a flesh. So I do not want any kind of experimentation. So passive euthanasia can be given. Active euthanasia, where you are just injecting some poison, it's not being permitted in India. Then we have is assisted suicide, where patient is conscious and again he wants the doctor to kill him. That's another term which is used in you can say European setups, not in India. So that is assisted suicide. So what we have is passive euthanasia and active euthanasia. A lot of again ethical permissions and informed consents are required. And in those patients who are unconscious, in those cases, the family members have to give the consent. And if it's a child, in those cases, the chief judicial magistrate and child welfare officer and the labor officer of that district has to be contacted. This is what.
In both cases, this ethical consideration is same, active and passive.
It's the same. Only the conditions differ, depending upon the circumstances of the patient or the kind of patient, that will differ.
Okay. Thank you, ma'am.
Active euthanasia is not totally banned in India. You cannot give active euthanasia is in any case. After Aruna Shanbag's judgment, that nurse who was in the King Edward Medical College for 44 long years in cerebral hypoxia and permanent vegetative state, the judgments of Mr. Justice Markandeshwar Karju and Gyan Sudha Mishra of Supreme Court have completely put up a blanket ban on active euthanasia. Even for passive euthanasia, also there are a lot of conditions under which it has to be given. There are a lot of conditions by law.
Ma'am, I am from Odisha, ma'am, Mrs. Ranabala Pradhan. Good evening, sir. Good evening, ma'am. Sorry. Very well presented, ma'am. Your presentation is very nice. So many times I already attended your webinar. Ma'am, actually my question is, I want to know about the bioethics regarding the hijras. What is the rule? Hijra, that third gender.
He's a
You
transgender.
told about that third gender. That's I want to know about again that explanation.
First thing is bioethics are not only in the medical practice, they are in social practice, they are in your civil life also, in your professional life also. Hijras now have 1% reservation in all the government jobs in India. Thank God, a very big NGO of Mumbai, I think it's, I forgot its name, I think People for Humans, something like that. They made a public interest litigation in Supreme Court. And what about these people who are natural hijras, or you can say natural transgenders? We can see them begging on road, we can see them dancing, we can see them clapping the hands on the road and the street. So now 1% seats are reserved for them. This year, last year in the medical colleges, 5 hijras got admission in India who are about to become doctors. Past 5 years, there are right now about 25 hijras who are becoming doctors. The first superintendent of police, an IPS officer, has been employed by the Madras police as superintendent police, and one lady is right now sub-divisional magistrate in Kolkata. The same train where she used to run, where she used to sing, where she used to dance. Right now, same train she goes when people give her salutes, because now she is a sub-divisional magistrate, where she used to dance for money, right? So that is the first hijra who has joined the IAS, IPS also. Okay. Now you're coming about the healthcare rights. They can get all access to healthcare, medicines, doctor checkup, everything, admission to hospitals, but they cannot adopt a child as per the CARA policy. People, the government of India thinks, the policymaker thinks, the public health economist thinks, the doctors think that they are not knowing how to rear a child. Maybe there are many other issues also. They do not know how a gender evolves, how a child is born, how a male child or female child evolves in the universe. How do we rear them? Because their upbringing is in a big cruelty. These people's upbringing is in a lot of pain and agony. So they might not, their mental capacities will not be that much enhanced. There may be other issues also, but I think as per the rules, they cannot adopt a child. And they cannot even ask a surrogate mother to give them a child.
Ma'am, if he's become a earning member in the society, he or she can adopt the child, no, ma'am?
Who?
Ma'am, that hijra, if he become a doctor, if he become a IPS officer, so
even if you are SDM, profession has got nothing to do with your personal life or with your sexual life. No, they cannot. Even if you are a doctor, you cannot adopt a child, and neither you can ask a surrogate. Okay. As per the law. I think some petition is still going on in the Supreme Court. I'm not sure of it, but it is going on for their rights. And even a single father, not a gay father, a single father like a doctor. There are nowadays, even there are a lot of my friends who voluntarily decided to remain unmarried. They are not gays, okay, but they are. They said that they will not be allowed to adopt a female child. A single man cannot adopt a female child.
Oh, okay, ma'am. Thank you, ma'am. Thank you so much, ma'am.
Your opinion regarding the application as well as adaptation, we can say. Adherence in the medical field as well as nursing field regarding bioethics.
Adherence comes with information, education, communication. First thing is IEC comes here. As far as adherence is concerned, law is the law-abiding authorities. The police and the legal system in India will make doctors and nurses adhere to bioethical principles while treating the patient, while testing any drug on patient, or while doing any kind of medical or nursing research on the patients. If anyone complains to the higher authority or the legal authority, they will be in trouble, and even their licenses will be cancelled. Medical Council of India has cancelled the license of 2 doctors, as far as I know, in Dr. Anamika, okay, case. This is a very big case of medical negligence where the licenses of 2 doctors were cancelled by Honorable High Court, and now the case is in the Supreme Court. There is a very big Facebook page, Stop Medical Terrorism. So it is Fight for Justice for Dr. Anamika Ray. She went for a simple laparoscopic surgery. You all know laparoscopic surgery where your gallbladder is removed, and her dead body came out after 4 days, Right now, her husband, Dr. Ankuran Datta, the head of the Department of Journalism in Guwahati University, is running from pillar to post to get justice for his deceased wife. So this is a very big revolution started by Dr. Ankuran Datta, namely Stop Medical Terrorism. You all can please like this page on the Facebook, Stop Medical Terrorism, Justice for Dr. Anamika Ray, how she died. And it's a complete case of unethical and immoral practices by medical professionals. A young life was lost, a budding researcher, a very big media journalist of our country, and the only child of her parents. So right now, her husband has made a very big NGO. He has taken a lot of projects by United Nations, by Commonwealth, where a lot of issues, these kind of issues are being addressed, and adherence to ethics is being promulgated with a lot of impunity in India.
Thank you.
Saying they're asking that why men are not allowed to adopt a girl child because of the issues of infertility and personal choices of not to get married. I do understand, but the Ministry of Health has said because a man may have find some difficulties from psychosocial point of view, or they think that the policymakers think that the man will not be able to rear a child, a female child, whereas a lady or a female sex can, you can say, rear both the children, that is male and female, as a single mother, but a man cannot rear a girl child because of the gender issues, or because of some psychological issues, or because of some maybe the psychosexual development may not be proper. So there are a lot of researches actually also taking place in this. So maybe there are various reasons that why it's not like that. There can be some other reasons also. So the policymakers in India have banned the men from adopting a baby girl, single men.
For the session today. At the end, may I request Radha to give few words to the participants.
Thank you all of you for your precious time. Grateful to all of you. If you have any other questions, you may contact me on my phone number 9881-26562. A few of you requested me for the PowerPoint presentation. I'll give you. My email ID is radha_s26@yahoo.co.in. Last but not the least, thank you, Penjor and ma'am, for giving me a chance for presenting here on this forum. And thanks, and I'm grateful to all of you for your time.